Hey, functional friends, Bren Vermeyer here. Welcome to the Holistic Savage podcast, where we like to talk about all things related to functional health, including functional medicine, functional fitness, functional spirituality, functional psychology, and basically everything in between. And of course, you can't spell functional without fun, so we like to have a good time on this show. Now, before we get started with introducing today's honored guest, I want to remind you all that the content of this podcast is for educational purposes only and is not at all intended to be a replacement for supervised healthcare. So be sure that you're working proactively with your licensed healthcare provider to make sure that all of your healthcare and medical needs are being met effectively. Of course, if you're interested in our functional services at Metabolic Solutions, you can send us an email at info@metabolicsolutionsllc.com, and of course, visit our website, metabolicsolutionsllc.com. Also, if you love this podcast, I would really appreciate it if you share it with your family and friends. Like it, follow us, subscribe, review. It really means the world because ultimately, I believe that the greatest medicine of all is to teach people how not to need it. And the first step towards change is awareness and then education and empowerment. So that is what my platform is dedicated to. That's what this podcast is dedicated to, is helping educate and empower self-healers around the world so that they can overcome their greatest health objectives. So be sure to subscribe and leave us a positive review, and don't forget to share with your loved ones. So without further ado, let's get started with today's guest. Thank you so much for being here. All right, ladies and gentlemen and functional friends, let's go and get started with season 2, episode 11 of the Holistic Savage podcast. It's my honor to welcome and introduce my good friend, colleague, and peer, Gavin Gard, who is a functional medicine practitioner and the medical director of Roots Integrated Care, which is his private functional practice. So Gavin's been a friend of mine for a while. I genuinely think that we could probably pass as brothers if we wanted to pull that off. But allow me to formally introduce Gavin. So Gavin is the medical director of Roots Integrated Care. Gavin is a native to Friday Harbor as a 6th generation Islander. He graduated summa cum laude from Whitman College studying biochemistry and received his master's degree as a physician's assistant from the University of Colorado. His work revolves around helping his patients realize their optimal health through building resiliency and guiding them through the common challenges that get in the way. He believes the way to a happier world is by building healthier people. The main principle in his work is to make this model of care more accessible and affordable. So certainly that resonates with me a lot, and this is why Gavin and I get along so well. So I had an amazing conversation with Gavin, primarily centering around TBIs, concussions, brain injuries, and the resulting neuroinflammation that can often complicate health programs. So without further ado, let's get started with the episode. Thank you for being here. Mr. Gavin Gard, welcome to the Holistic Savage podcast, where we like to talk about all things related to functional medicine and holistic health. So I'm super excited to have you on. I genuinely feel like we could probably pass as brothers. So I think this is almost like an overdue conversation, but I'm really excited to dive in. We're going to be talking about brain injuries and neuroinflammation and all of that good stuff. So welcome to the podcast, my friend.
Thanks, brother. Appreciate it.
Absolutely. So Gavin, I know you're a physician's assistant, correct? That's like your credential in your background, or?
Yeah, so physician assistant. I went to a 3-year program in Colorado, graduate program after doing undergrad. Yeah, it's pretty, like, in marketing terms, it's a really bad name. Like, physician assistant's a really bad name for what we do.
Yeah.
And they may change the name to like something like physician associate just to like better describe what we do. So yeah, that's my background. Certified nutritionist, and then have some various functional medicine training.
Yeah,
also.
absolutely. Well, I mean, hey, you it's still like picking fun at myself. My background is bro science, so it's just like
There you go.
it's all good. And that's kind of a big part of it with the functional integrative modalities is there are no there's people don't get this, but there's no such thing as a doctor of functional medicine. Like that credential doesn't exist yet. And
Yeah.
so I don't think people get that. And yes, I think the industry is kind of dominated by doctors, but that's changing a lot because there's a very different style of different backgrounds. And what I love about our industry is the diversity of it. Diversity is the richness of all life, right? We love richness and diversity in the microbiota, and same thing with our industry. Of we have every type of background, whether it's personal training or health coaching or whatever it is. So I'd love to hear a little bit about what steered you into the functional medicine industry to kind of start as we work our way towards brain damage and stuff.
Yeah, I mean, so I guess I'm a anomaly, like there's a lot of functional medicine providers that had like this big health crisis and then they sought out some functional medicine provider, got fixed, and they're like, okay, I have to go down this route. Right. I mean, you kind of have like a similar story, right? And that's what got you into it. I don't really have that. I guess I've always been, involved in sports and whatnot growing up, fairly healthy. Um, I started getting into CrossFit. I guess that was my first introduction just to like fitness and health in general. I did some coaching and I coached all through my undergraduate and a little bit in grad school as well. I guess that was my first introduction into like just helping people out in general. Right. And I feel like such a big part of what I do right now is coaching.
Hmm.
It's just coaching on like a different level, right?
Hmm.
You're helping people make these drastic changes in their health. And just kind of going back to what you said, like, I love, man, I really admire how you don't limit yourself to like not being a doctor. And so therefore you can't help anyone out. Like you've taken this a growth oriented approach to be able to help out anyone that wants to seek you out, and you're not limited by your training.
Hmm.
Um, and so, yeah, so I went to PA school. I thought about going into med school. I'm like, no, I think I could do a lot with what I wanted to be as a PA. And yeah, so I did some functional medicine training throughout PA school. I woke up early every morning, try to study this out, try to see how this was fitting into what we're learning through PA school. And man, I learned so much throughout PA school, but I feel like that was just only the beginning. That only
Hmm.
kind of gives you the fundamentals to be able to put these complex pieces together. And I'm sure about the Dunning-Kruger effect. Like, but the more you start to learn, the more you realize how much you truly don't know. And so I've just kind of taken this like internal drive of mine to just seek out more information, figure out how this complex physiology that is our body works, right?
Hmm.
Um, and you can't really be a specialist in any one thing in functional medicine, right? I've thought
Hmm.
about my okay, I'm just going to work on the gut, but then you're missing all these other things that have a profound impact on someone's health, right? So the last few years I've just been trying to study as much as possible. I just think functional medicine makes sense. That approach makes sense, and there's nothing wrong with conventional medicine. It's just how I want to practice is I want to take time with my patients. I want to see results, and I just don't think that medication should be the only tool in our toolbox. So long story short, don't have any fancy story, but this model of medicine just makes sense to me. I've seen it transform patients' lives, and that's just why I wanted to practice and dedicate my career and mission to.
Hmm. Well, and I'm having fun already. You made a lot of valuable points there. And I love kind of dissecting like what is, functional medicine, which is kind of this exploding paradigm and, in a way sort of birthed out of naturopathic medicine and whatnot. But the beautiful thing about, whether we want to call it functional medicine or functional health or holistic health, integrative, it doesn't matter. It's like you could literally take integrative, functional, holistic, naturopathic, alternative, complementary, whatever, throw it in a blender and just see what comes out. But one of the things I really am trying to do with my career is kind of closing that gap between like the doctors and the health coaches, because the reality is if you are, applying, functional principles, well, it's like 80% lifestyle, environment, psychology, like meaning that you don't need a medical license to do that work. Like you need a medical license to prescribe drugs, perform surgery, make a diagnosis, whatever. But that is kind of opposite of the whole point of the functional paradigm. And in a lot of ways, I really believe functional medicine is what the practice of medicine was always supposed to be. But we lost our way with kind of this bastardization with the rise of big pharma. And hey, the more I learn about the way conventional medicine operates and pharmaceutical science and all that, it's amazing. It's so impressive. Like, but that's not the problem, right? It's obviously we can't medicate or cut our way out of what is ultimately an environment, lifestyle, behavior driven crisis. So no, I love what you're saying, and ultimately, I think we have to use this more functional, holistic, all-encompassing approach that uses the psychology, uses behavior modification, environment, lifestyle as our main tools. That's how it's supposed to be.
Yeah, and so I was just thinking when you were talking, I'm like, I think functional medicine kind of has a marketing issue. You know what I
Yeah.
mean? So in conventional medicine, when we use the word functional, like functional dyspepsia, functional fill in the blank, it means it's idiopathic. In other words, we don't really know what causes it. So
Yeah.
if we're using the term functional medicine as a way to describe that we're trying to figure out what is the cause of the symptoms, that may be a marketing issue that we may want to figure out down the road. I just use it because it's a common term that a lot of people know about, and it's a term that they're seeking. And I know, like, a common mentor of ours, Brian Walsh, Dr. Walsh, I've been trying to adopt his approach of tying together what we know of conventional medicine. So conventional medicine is great at saying, okay, here's how the body works. Pretty much everything that we know about the human body can be attributed to the drive to make drugs and surgeries to fix a lot of these chronic health issues. And through that quest, we have learned a lot about the human body that we could then use through a functional medicine approach. So what I've been trying to do is blend those two together. And my training was absolutely phenomenal in learning all the physiology. I remember some of my classmates are like, we're never going to have to use this physiology of how the kidney works, this, and that. I'm thinking to myself, I'm like, this is actually pretty important stuff, right? If you know this, then you can read any research paper, you could learn about any new and upcoming drug, and you could figure out how that fits in, what are some of the potential side effects, and then weigh out that risk and reward ratio. So that's kind of the approach that I've been trying to adopt, through my early career as a clinician.
Mm-hmm. Well, absolutely. And I can't say enough good things about, Brian's way and his teachings and everything, because you're so right. And unfortunately, we live in a very polarizing world, and 2020 has only made that much worse. And so unfortunately, there is this kind of polarization to conventional versus functional. And the whole time I'm over here scratching my head, like, versus, like, aren't we all kind of in the same crisis together? Shouldn't we all, be
Yeah.
working together to try to figure out what the hell's going on? But I think, conventional medicine, I kind of describe it sometimes. I hate politics, but it is almost kind of like the political spectrum, where it's almost like conventional is kind of like the overly conservative to the point of being arrogant, and dogmatic. But then you got functional medicine that, if anything, is too sensationalized, and oh yeah, let's just do $3,000 lab testing, we'll find your root
Oh
cause,
man.
throw a few supplements at it, and poof, you just magically get better. And it's like, okay, the truth is probably somewhere in the middle of this giant polarized spectrum here.
Yeah, and so I'm so glad. I mean, we haven't even got down to the meat and potatoes, what we're going to talk about, but I think this is a good conversation. So let's keep on rolling with it. The whole thing about functional medicine, and it kind of sensationalized everything to a point that it doesn't even become evidence-based. And I hate the word evidence-based because it's thrown out in both circles. And what does that mean? What we were taught in my training is evidence-based has three different factors, right? It's actually looking at the evidence. It's taking into consideration the patient's preference, and then also taking into consideration the clinician's experience. But we always refer to evidence-based as being, okay, what does the science say? Never ever talking about what does a patient want and what does a clinician experience, right, in their career. And with that said, I think we kind of throw out that term, and we don't really know what it means, right? So yeah. Yeah, it's frustrating. So one of my missions with, the way I want to practice is to be cost effective.
Hmm.
And so you mentioned, throw out a couple $1,000s right at first. We may do like I'm not going to say any names, but we may do a fancy hormonal profile throughout the month. And we may do, a couple $100 GI panel. That's already, probably $600. And then we want to add on something more. Now we're already up to 1,000. We haven't even run some basic blood chemistry. I know you're a big fan of that. I learned from Dr. Walsh and his blood chemistry workshop, and I've been using that a lot through every single patient that I work with. We know that blood chemistry is a validated marker, right?
Hmm.
And we're so quick to just throw that out as not being very useful. So yeah, that's one big thing that I've tried to implement in my practice. How can we be cost effective? Not give someone 30 different supplements and 4 different lab panels. And I kind of take it in a stepwise approach. Like, how can we focus on this, prioritize all the different problems, focus on one at a time? And I think patients appreciate that. One, it's more cost effective, and it's more sustainable, and they're able to implement that a
Hmm.
little bit better. Um,
Absolutely.
so yeah.
Yeah, and like I like to say a lot, functional medicine isn't very functional if nobody can afford it. And
Yeah.
unfortunately, I do already see this happening where I feel health is becoming a luxury good for the elites. Like that's kind of what's happening in our
Yeah.
country, which is honestly kind of disgusting and appalling to me because it's so twisted and backwards from like what we're supposed to be all about. And then there's kind of uh this movement, a lot of functional alternative, like they don't want to be confined by insurance, which I can understand and respect, but then it's all out of pocket. And so it's so expensive. And
Yeah.
there's new labs hitting the market every day. And then you do like, how functional is functional lab testing? You start looking into the technology or the research or lack thereof. And it's like, well, just because we can measure something doesn't mean we should, doesn't mean it's helpful, doesn't mean it's necessary. And then all the while, like, what the hell does the person sitting across from us with eyes, full of hope, like, help me, like, what do they want? And so I love what you're saying because, when I first got into this space, at first I was worried that, like, without a medical license, nobody would give me the time of day or whatnot. But I've really found it's kind of my greatest strength because I don't have that domestication and conditioning of how it should be or what it's supposed to look like or whatever. And it takes a lot of outside the box thinking because I've always looked at it as like, well, the health building process is largely psychology driven above all else. Um, and I always liked using objective data to guide that process. So, the company I started my career with, we had VO2 testing at our fingertips. We had, body fat scanners that were highly accurate. We had, blood pressure. We had blood testing. So it's like, well, use that objective data, but ultimately it's the holistic health building, health coaching process that needs to be client and patient centered. And I think we've lost that. We're too caught up in the fancy test of the month and the fancy supplement protocol and all that good stuff.
Yeah. Yeah. I don't think because something is new that we should just jump on it, right? Because a lot of times we haven't actually validated that research for ourselves, right? A lot of times it's pretty expensive, and what do you do with that information?
Hmm.
And so I've learned so much through gathering a really good history. What are their symptoms, and how could possible lab markers play into that? If it doesn't make sense and you can't make a correlation, then maybe that shouldn't be a clinical target or priority for you.
Hmm.
A good physical exam is also important. So I think those two together, and when you do labs, you should almost um, predict what's going to happen. So it's no surprise to you when you see, okay, they're iron deficient. Well, I already kind of assumed that, right?
Hmm.
So it only reinforces your treatment. And most of the time you shouldn't be surprised.
Right, right.
Yeah.
Well, and that's part of the problem is I think a lot of practitioners, professionals are kind of running a test to feed their own confirmation bias. And it's like, well, when you're a hammer, everything looks like a nail. And so, like, a really good example, we were chatting the other day on Facebook about mold, which, yeah, it's a huge thing. I do a lot of work around. But it's like, mycotoxin test as a good example where depending on which lab you go with, it's going to come back high for like ochratoxin or gliotoxin almost every single time. So if you're just like either a green practitioner or a client or a patient or whatever, and you get this piece of paper back that's like you have high levels of this toxin coming out of your body and it's associated with cancer and like everything bad, you're going to freak out. So I always kind of tease, like, I think sometimes we're a lot better at making problems than solving them in this industry. So to your point, we have to put it all together, and I don't see a lot of that being done, unfortunately.
Yeah, I mean, a lot of these, like you said, a lot of these functional medicine tests are imperfect. You got to take their history into account. Does that make sense with their symptoms that they're presenting with, and with their physical exam? And I agree with you. I do think I see mold mycotoxin being one of those sensationalized topics within this realm. To be honest with you, I don't know much of mycotoxins. I'm not an expert whatsoever. I'm very new to it. So I'm sure you could speak more to that. I've seen a lot of practitioners kind of use the mold and think that everything's a nail, and then use their one hammer. And you could speak more to this, but it does seem like mycotoxin treatment is like, it's a rabbit hole, right? Like you're talking about months and months of treatment before you get actual benefit from that. I don't know, you'd probably be better to speak to that point.
Well, it's just one of those. I think ultimately the takeaway is, we have to. And I say this to my students all the time. Of like, it's that balancing act of not missing a healing opportunity where there actually is one, but not creating a problem where there isn't one. And that's that's difficult and takes good practitioners. So I think that was a really good kind of setting the stage, sort of like an intro into just the world of functional medicine. So now in regards to, brain injuries and neuroinflammation, I'd love to kind of steer into that a little bit, because I understand you've been doing a lot of research into that subject. Yeah.
Yeah. I don't know what got me into it. I feel like I have research ADHD, like big time. Maybe I actually have ADHD and I just don't know about it. Maybe I need to do something about it. But yeah, I've researched ADHD. I was like, oh, let me just study this. So I spent a few months studying this. I'm like, why don't we ever learn this stuff in like school or, functional medicine or whatever? I was really surprised by some of the things that I found. And I'm sure we could talk more about that. Maybe I could just touch on like the epidemiology or who's affected by TBIs. So I think it's a lot more than what we think about, right? We think of TBIs, concussions, of like just football players and veterans, and that was one of my big interests in studying this in the first place. I have a heart for veterans that, that they and their families sacrifice so much, and a lot of them come back home and get inadequate care. And a lot of their problems may be attributed to traumatic brain injury and the long-term results of traumatic brain injury that go kind of poo-pooed in this conventional medicine realm. So every year there's around 2 million emergency department visits. We have about 280,000 hospitalizations, and around of those 250, 280,000, about 50,000 die every year. We have about 3 million people affected, lifelong disability as a result of a TBI. So just that, 3 out of that's probably 1% of the population, maybe a little bit less. So here's the scary thing though, is that we have this kind of antiquated grading system called the Glasgow Coma score, the GCS score, and it has to do with your eye opening, your motor involvement, and your verbal response to some questions. And the thing is that what we classify as quote unquote mild actually has long-term disability associated with it. So 75 to 80% of all traumatic brain injury, TBIs, concussions, are classified as mild. And what that means is, after we rule out an emergency, you go to the emergency room. Even if you do go to the emergency room, a lot of times, we have high school athletes, college athletes, people in motor vehicle accidents. They just kind of brush it off. We maybe just say, oh, there's no issue, I feel fine. They don't even get any care. All the while, there's background derangements and disruptions that are occurring. So after we rule out an injury with, let's say, a CT scan or some other imaging modality, a lot of times we just chalk it up like, oh, it's just a mild concussion. If people have, symptoms weeks or months down the road, they may see a neuropsychologist, get a pretty lengthy workup. And then from there, they don't get much care after that. And that's scary, right? because, these people, we know from the literature that, and we could talk about this more, but a traumatic brain injury is a disease. It's not a one-time event. And so from the mouse literature, and we're kind of limited in how we can do research. We can't just knock people on the head and then
Right.
do a randomized control trial. We could talk more about the quality of evidence. Um, but yeah, so we need to rule out an emergency. And we know from the mouse literature that inflammation can occur for decades down the road.
Hmm.
And that's pretty scary because a lot of people are not getting the adequate treatment that they deserve.
Hmm. A TBI is a disease, not an injury. That was powerful. And it's fascinating. I recently, I've never looked into TBIs or anything, but I know a thing or two about neuroinflammation. That's kind of big focal point of some of the stuff I do with mental health, obviously. And what's interesting, I was just watching that movie with Will Smith, Concussion, the football
Hmm.
movie. I just watched that maybe like a couple months ago. And what blew my mind, and this is what's funny, and Brian says this all the time, kind of poking fun at how, well, you said it earlier of how much we know about the human body, how much, and it's like, it is amazing how much we know about the human body and yet how little we really understand, right? And Brian always kind of pokes at that of like, guys, I don't think we're even close to being right with some of our theories and stuff.
Yeah.
And I think he's so true because when I was watching that movie with Will Smith, and obviously dramatized, but nonetheless, Doctor Dude going to the neurologist, scientist dude, and trying to convince him of like, hey, when there's repetitive head trauma, there's some sort of inflammatory response, and it causes this long-term damage, and how stubborn and arrogant, like, no, the science doesn't support that, whatever. I'm watching this movie like, wait, it was really just 10 years ago that we were like sorting out that, like, hey guys, wait a second, if you hit your head over and over and over, that maybe can lead to like long-term damage or long-term degeneration. So I was just so blown away because like we've lost common sense so much with our scientific pursuits, which really disturbs me. So my point being, like, if it was only 10 years ago that we finally accepted, like, yeah, repetitive brain trauma can cause long, I was like, I've lost all hope. Like, there's no hope for us,
Yeah.
But so I think it's really interesting. And I would imagine, I'd love to hear you speak to maybe some of what we know about this, because just from what I do know, I can imagine, okay, some sort of injury to the head, whether, you hit your head or whatever it is, car accident, so on and so forth, and you rattle your brain against your skull, and you actually do, it's like a bruise of the brain, and that could activate like the damage associated molecular patterns and kind of that inflammatory cascade. But I'm curious to hear what you found with, why is that? Why is it not just like a bruise that we get on our elbow or something of like it just heals up? And why would it cause this like long-term inflammatory cascade? And what could some of those like long-term consequences be? The proper intervention, really.
Yeah. So kind of going back to my first point is, I think that if someone was listening to this, and they're actually seeing patients, they're a patient themselves, I think the biggest takeaway would be to know that a traumatic brain injury, concussion, is a disease. It can lead to long-term downstream negative effects, right? So what we know from looking at NFL players is anywhere from 30 to maybe 90%. I know that's a big range. When I saw that, I'm like, how do you go from 30 to 90%? So it's looking at multiple studies. So a review of these multiple studies show that 30 to 90% of NFL players have something called CTE. It stands for chronic traumatic encephalopathy. Is pretty much just neurodegeneration as a result from getting hit in the head over and over and over again, right?
Hmm.
And to your point, like, why couldn't this just be like a normal bruise on your arm that goes away, right? There's something that's inflammatory, or resolution toxic, what we would call it, right? So the body, for some reason, there's some factor or factors that is impeding on the body's ability to clean up that inflammatory mess, right? And the downstream cascade that can be a result of it. The truth is that, symptoms. I'll just tell you, your brain is probably one of the most incredible organs out there. I mean, I know like the liver's pretty cool, the gut's pretty cool. Everyone talks about the gut. Maybe it's going to be the kidneys next. Who knows? Like, but the brain is pretty amazing. It does have the capacity, if your body is overall healthy, to ameliorate symptoms within 7 to 10 days, right? It should clean up all the mess within 7 to 10 days. You should probably wait a week or so before you start exercising, and as symptoms allow for. So the reason that your brain may not be able to clean up that mess is kind of multifold. I would say one of the first factors is you have to get a good history in what is their state of inflammation prior to that TBI, right? So we know that herpes virus 1, HSV1, increases the risk of dementia by 20% in those with concussions or traumatic brain injuries. You could also look at genetic markers like ApoE4. However, I kind of question of like how clinically useful is that, right? I know Dr. Tommy Wood has done some good work on the epigenetics of ApoE4 and a lot of these genetic markers that we always talk about in functional medicine, and whether they really make a big difference or not. I don't personally, I don't know how much saying that someone risk of dementia increases by like 400% is going to help them out. Like it may depend on the person, right? If they're kind of on the fence of whether they want to carry out your treatment, yeah, maybe it's a good idea to get some buy-in, but are you going to scare a anxious 20-year-old male who is like coming to you for some hope? I'm like, hey dude, by the way, your risk of dementia is like 400% greater. Like, I just don't know how useful that is. So you have to look at the state of inflammation prior to the concussion or multiple concussions. And then we can start getting into like microglia and immune system activity. So this is one of those topics that, was like so complex that I'm going to really simplify just for the sake of simplification. But in all reality, like we don't really know, like with pretty much everything about the human body. We're just trying to do our best with what we have. So microglia, these are your brain's immune cells. They're very privileged to the brain. And in fact, they actually come from a separate lineage or like parental cells as compared to immune systems outside of the brain or in the periphery. So these microglia, they kind of tell who's good and bad. If it's bad, of course, then they're going to elicit an immune response and clean up that damage. And that could be through a pathogen, right? So a virus or a bacteria or bacterial components that get into the brain after a concussion, because we know that the blood-brain barrier opens up after a concussion. Or as you alluded to, DAMPs or damage-associated molecular pattern. These are things that our microglia or our immune cells identify as something that shouldn't be there, like something's kind of going wrong here. So if we look at like free ATP, if we look at other cellular fragments that don't look right, then our immune system, those microglia, are going to mount an immune response. And that's good, right? Like you want your immune system to clean up that mess, but you don't want those microglia or those immune cells to be on all the time. So then you look at, okay, so what's causing this perpetual microglial priming? So priming is just a fancy word for saying activation. So frequent and repetitive concussions are associated with this microglial priming and this subsequent inability to calm down this inflammatory cascade or process, right? So after you have one concussion, those microglia are activated for about a period of a month or like 4 weeks.
Hey guys, I just wanted to take a moment to thank you all so much for listening to the Holistic Savage podcast. We on the Holistic Savage team all really appreciate you and want to stay connected with you. So please rate, review, and subscribe to help the podcast grow. And if you like the podcast, help get the word out. And now, back to the show.
While you are in that time frame, if you sustain another traumatic brain injury or a concussion, those microglia are now going to be primed for about 16 weeks. Right. So you just start to think about these high school players who get a concussion and their coach slaps them on the butt. They're like, hey, buddy, get back in. This is your senior year. and then they sustain another concussion within that same game, maybe even like a week or a couple of weeks later. They haven't done anything to heal their brain. All the while, they're drinking Gatorade on the sidelines, and we could talk more about the metabolic perturbations of a TBI. If you sustain a concussion within that 16-week time frame, a third one, then those microglia might be primed forever. We don't really know. That's just some mechanistic data. There's no medications for this. That's scary, and you start to look at, I want to reference Tommy Wood again, but he has some good papers if people want to look into this. He's from, home state at University of Washington here, but he's done some good papers looking at, how do we look at these neuroinflammatory, neurodegenerative diseases. And the fact is that 95% of these medications that go into phase 1, 2, and 3 trials through the FDA to solve some of these chronic neurological conditions, they fail, right? So that means only 5% actually go through the market, go through phase 5 and actually get on the market. And then you have to question, do they even work, and how much do they work? So to summarize, we first have to look at what's their state of inflammation prior to sustaining that concussion. We want to limit subsequent and repetitive concussions within that healing time frame, and then do everything that we can to heal the brain and that inflammatory cascade. And I don't know if you want to start talking about what we could do for that. I'd be happy to talk more about that.
Yeah, no, this is cool stuff, and we'll get into it, because I mean, one of my best friends has had a TBI, and that's, a big thing for her. Or one of my other friends recently had a concussion, and obviously the the most like unhelpful but obvious takeaway would be like, all right, well, don't hit your head, especially not more than once. And then of course with what we're talking about with like the microglia activation and all of that, you do start looking at like something I talk a lot about, because the big thing I focus on is mental health, and primarily how we're really now looking at mental health through the lens of inflammation. And it's like, oh, actually depression is an inflammatory driven disorder, just like pretty much everything else. Like what a thought. And I think some of the pharmaceutical science is really cool, whether it's all these new, oh man, the pharmaceuticals they're making of like TNF alpha inhibitors, or it's a lot of the drugs that they're cranking out, whether it's for depression or rheumatoid or some sort of autoimmunity, a lot of it is trying to block cytokines. Like they're currently, they have IL-6 antibody drugs in phase 2 clinical trials for treatment-resistant depression.
Yeah.
Which is interesting, and then of course you hear or whatever that autoimmune drug that I saw a commercial for, and they always whisper the scary things like while distracting you. But it's like, okay, well, if we're blocking this cytokine signal, it's like, well, yeah, but what do those cytokines released by the T helper cells do? And it's like, well, it initiates an immune response. So then it's like, oh, well, it may lower your immunity and make you more susceptible to bacterial infections and all of that. So part of what I think, obviously, so don't hit your head, but if you do hit your head, how can we kind of calm down that inflammation long term? And of course, you start looking at the standard American lifestyle, and it's like just about everything about it is super inflammatory. So yeah, let's start unpacking that a little bit of like, okay, so you did hit your head, you do have a concussion and or maybe a more severe TBI. Like where do we even begin to support the body in its natural healing response?
Yeah, and just to your point, it's like it's easy to say to someone, "Oh, don't hit your head again." It's like a doctor saying, "Oh, you have hip pain," just like don't walk or don't exercise.
Yeah.
I guess that's more so for athletes, right? You look at high school athletes; they're 3 times more likely to get concussions than college athletes. That may be due to their neck strength. I don't know. But as far as what we can do, what are some clinical targets is what you may be asking, right? So what are some things that we can intervene on in helping that individual or patient heal from the long-term detriments of concussion? So I think the biggest one, as we've been talking about, is inflammation, right? you have to address the source of inflammation. So we know within 30 minutes that our gut barrier opens, right? It allows this influx of lipopolysaccharides and other endotoxins and bacterial fragments into the brain, into the central nervous system, because the blood-brain barrier opens. So normally these things called astrocytes, they kind of wrap around the vasculature around the brain, and they only allow certain things that are quote unquote privileged to enter into the brain, right? We don't want just anything entering in the brain. And that's why getting medications into the brain can be difficult at times, right? Because our blood-brain barrier is very selective in what it lets in and out. But after concussion, that blood-brain barrier becomes damaged. It can allow for bacterial fragments or inflammation from any type of GI or gut imbalance to cause central nervous system inflammation. You could also look at musculoskeletal health, right? If someone has chronic joint pain, or whether that's rheumatic or not, meaning autoimmune or not, then that needs to be managed as well. And you start to look at this bidirectional relationship between the gut and the brain. So the vagus nerve goes through the corticopontine network through the brain, and it feeds into this enteric nervous system of the gut, and that regulates digestive enzyme output, hydrochloric acid output, and then just overall motility. We see a lot of times that vagus nerve can become damaged after a concussion. That could lead someone to developing SIBO, or small intestinal bacterial overgrowth. But then also that GI imbalance can then feed back into the vagus nerve, right? Because there's both afferent and then efferent tracts within that vagus nerve, and that can cause inflammation within the brain. And then you just got this downward spiral, right? So I would say GI imbalance, if they have that, then that is a big clinical target to address inflammation. So as far as anti-inflammatories, so one of our friend's daughter sustained a concussion. She was like, should I start with ibuprofen, or like, what should I do? Because she was a mom who was caring for her kid, and she wants to know what she should do. And so what I would do with my kid, or if I sustained a concussion, is I would actually hold off from anti-inflammatories for a period of about 4 weeks. We see that clinical trials using anti-inflammatories, NSAIDs, things of that nature, fail actually in getting clinical improvement in a lot of these larger, more severe concussion trials. I found an interesting research paper that I'll have to send you, but they were looking at, should we use aspirin or should we use ibuprofen after that period of 4 weeks? Because the thing is, you don't want to limit inflammation while the brain is trying to clean up that mess. But as we said, we don't want those microglia and that immune system to be on for too long. We want that to subside and start to, not be always on, always primed. So after a period of 4 weeks, then we can start to introduce some of these anti-inflammatories. You could start, if it's in your scope of practice, you could use herbal bioflavonoids and anti-inflammatories. But we also have pharmaceutical approaches, so we can use over-the-counter aspirin. So there was an interesting paper that came out that looked at COX-1 versus COX-2 inhibition. So conventionally, we think of like aspirin as more of a selective towards COX-1 inhibition, and ibuprofen as more of a selective towards COX-2 inhibition. And that just has to do with blocking specific enzyme that makes particular cytokines or inflammatory molecules. So interestingly, a mouse model of Parkinson's had higher levels of COX-1 inhibition, and that inhibition increased survival, right? And in a traumatic brain injury, we get a preferential increase in that COX-1 enzyme. As we see from the literature, that aspirin may be better at targeting this COX-1 versus COX-2 enzymes in creating more anti-inflammatory effects. So that's one thing that I would consider, is maybe aspirin for a few months after a month after concussion. We could incorporate a modified elimination diet, incorporate some fasting, whatever the patient or the individual can handle. And another thing is addressing dysglycemia, or high or low blood sugar, because we know that kind of sets off this inflammatory process and oxidative stress and whatnot. So there's I'm kind of rambling here, And I'm kind of being tangential, but the fact is you have to see what is the lowest hanging fruit and then address that. There's just not one protocol that you could give to someone.
Yeah, no, and this is kind of one thing I love about just the functional approach is a lot of the same focal points are pretty much going to be the same almost regardless of like what you're working with or what demographic. Because like I really like what you're hearing. You're talking about microglia and blood-brain barrier and the gut-brain axis and a lot of the same stuff that I focus on a lot. But TBI versus like mold is big cause of neurodegenerative disease, or like with the microglial activation, even just high cortisol can activate that IDO pathway and feed into quinolinic acid and beta amyloid formation eventually, or whatever. So, I think it's really interesting, like, whether it's chronic disease or neurodegenerative or TBI or just depression, it kind of keeps coming back to inflammation. So then it's like, all right, so how do we unpack that inflammatory picture and how do we monitor? Or a lot of it comes down to adopting an anti-inflammatory lifestyle, right? And so, and the tricky thing that I don't think we really do know is like, well, we can, we have these fancy drugs to block this cytokine or block this enzyme for, the prostaglandins, or, whatever it is. We have all these fancy mechanisms that we can target, but we don't necessarily know what the repercussions might be longer term. So I like what you're saying as far as identifying some of those key drivers of the inflammation, whether it's that gluten that they're shoving in their face 5 times a day, or their gut bugs or whatever else. And it's picking that low hanging fruit to just calm down the overall inflammatory cascade, right? And then we're at least setting the body up for the best possible chance to heal, or at least mitigate some of the damage.
Yeah, exactly. I like what you said about adopting an anti-inflammatory lifestyle, because it goes into some of these other just simple habits of like, are you getting enough sleep, right? Mm-hmm. Are they stressed out of their mind? We know that stress chemistry is going to be at least contributing to further inflammation, neurotransmitter imbalance within the brain, and some downstream negative effects. I guess we could also talk about like this term, like excitotoxicity. Is that something that you've heard? Or
yeah, let's get into excitotoxicity a little bit, because especially with the microglial activation, and I love, so I have a thing for the kynurenine pathway, which is all about the microglial activation. And the main things that I'm looking at with that is like cortisol, LPS, mycotoxins, phthalates, I think TNF alpha maybe. But that pathway is really interesting. And there's so many papers that show, higher kynurenine metabolites in people with depression or neurodegenerative disease or this or that. And quinolinic acid being a cool organic acid marker that is really a neuroinflammation marker, or neoterin, which is released by activated macrophages. I don't know about microglia. I'm not sure how macrophages and microglia are super different, but
how are you measuring that? Are you doing like an organic acid test, or how are you utilizing that in practice? Because that's something I don't know much about, and I'm just kind of curious in how that fits into this picture of concussions and neuroinflammation.
Yeah, so with like the urinary organic acids, I mean, I dream of someday having like a serum organic acid test, but the urinary, you can look at like some of those neurotransmitter metabolites, the 5-HIAA for serotonin, and kynurenic acid, and then quinolinic acid. So kynurenic acid is generally considered protective, although depending on kind of how you look at it. But then quinolinic acid is an NMDA receptor agonist. Mm-hmm. So it is neurotoxic, excitotoxic. And so you start getting into that, and like the NMDA receptor is such a big target for pharmaceuticals. Like, what is it? Ketamine or something like that is the drug that targets the NMDA receptor. So yeah, I'd love to, and Well, I'll circle back to that one. So I'd love to, yeah, kind of talk a little bit about, what is excitotoxicity and why should we care about it?
Yeah, maybe I could talk about the background, and then we could kind of discuss on like some possible
Yeah.
therapeutics. I want to hear if you have any additional ideas. So you look at excitotoxicity. When I was going through this TBI research, I was specifically looking at whether a ketogenic diet could or could not help with those struggling with the negative effects from concussions. And I kept on coming across this term excitotoxicity. I was like, what the heck is this? I've never had heard of that prior to actually digging through this research myself. And so there's receptors in your brain and elsewhere. They're called NMDA receptors, and it stands for N-methyl D-aspartate receptors, and they are responsive to glutamate and glycine. They act as a ligand. So these NMDA receptors, they're sitting on the cell surface, and when that glutamate pops on to that receptor, it allows this influx of calcium within the cell. And it also allows for sodium and potassium imbalances, right? So across the cell membrane, you kind of keep a stable ratio of sodium and potassium. Usually sodium's more highly concentrated on the outside of the cell, potassium is more highly concentrated on the inside of the cell. And when these glutamate or these NMDA receptors become activated as a response to glutamate binding, then you kind of get this electrolyte imbalance. It also leads to that calcium influx leads to mitochondrial impairment. So that's kind of that link between excitotoxicity and energy failure, right? So your mitochondria are constantly producing ATP and energy for your cells to do whatever they do within your brain. It's like neurons firing and astrocytes, being healthy so that they can create a healthy blood-brain barrier. So the NMDA receptor leads to energy failure. It leads to this calcium influx and this oxidative stress that can cause havoc within the cell. We know this is linked with dementia, Parkinson's, Huntington's, all these neurodegenerative diseases. So some takeaways that we could take from this is a ketogenic diet. We could talk more about this specifically about ketogenic diet, but it has been linked mechanistically, meaning that we don't have any great human clinical trials, but when we look at animal models and cell cultures, it has been linked with lower oxidative stress, improved mitochondrial function. We may want to limit some of these exogenous excitotoxic compounds that may exacerbate this process. So things like MSG, right? Aspartame. How do you pronounce it? I never know.
Aspartame, yeah.
Aspartame, okay. Yeah, aspartame, calcium and supplements you may want to limit. You may want to go on a like autoimmune paleo diet or some type of modified elimination diet, whatever the individual is ready to do. And you could do a lot of this by just going from like a standard American diet just to like a whole food base, maybe calorie restricted diet for its effects on the mitochondria and its energy production. There's some research showing that magnesium can kind of put a cap on those NMDA receptors and prevent that whole process from occurring. I would use magnesium threonate. There is some preliminary evidence to show that may be able to get through the blood-brain barrier a little bit better. Zinc can do this. The Department of Defense has some papers looking at all these nutritional compounds because that's a big population that is being affected by concussions. So zinc may show some promise with this. Ketogenic diet, as I mentioned, ketamine. I just briefly saw this. I haven't really dug much into this. I know they're using intranasal ketamine for depression with some promising results. And progesterone may be beneficial. I don't know. I haven't used that just because it's not that progesterone may not be great for the acute phase. It may be better more long-term, like a couple months after concussion or TBI. So those are some possible options that you could do or implement to a treatment plan to kind of decrease some of this excitotoxicity. Have you came across any research on ketamine?
I want to do a little bit more digging into it because there's so much that you can learn from looking at like, all right, what's the drug that big pharma is throwing at this situation. What's that mechanism? And, you start kind of unpacking that a little bit. I see them doing a lot of interesting thing with ketamine, and you also hear people that are like addicted to ketamine and whatnot. So there's certainly a lot of interest around that NMDA trying to either activate or inhibit it. It seems that the standard American brain tends to be very excitotoxic, and then you start zooming out, try to figure out like, well, why? Like, what is it about our environment and our lifestyle that's driving this excess excitotoxicity? What was I just going to say about that? So one of the things, ketogenic. So with ketogenic and whatnot, something I have been digging more into and trying to unpack is, so like ketogenic and then fasting upregulates autophagy, right? And so, that's one of the things I've been looking at more is like, okay, autophagy for the sake of mental health, brain health, neural health. And so I would imagine, kind of an educated guess, I'd imagine, ketogenic and then also fasting would probably be, good therapeutic for TBIs and whatnot. I've certainly seen a lot of great papers about that in regards to like depression, where, okay, so, what I've seen from the literature on fasting, autophagy, and depression is pretty much like acute fasting, like short-term fasting to upregulate autophagy related genes seems to have an antidepressant effect. But then, if you go too long, it can have kind of the opposite effect, which I just look at that from kind of a common sense lens of like, all right, well, short-term fasting might clear your brain out a little bit, but if you go to the point of being malnourished, then, you might get depressed again. But yeah, I could definitely see how like ketogenic and fasting would probably be really, really good for TBIs.
Yeah. Oh man, you brought up the word autophagy. So I guess we'll have to we'll have to talk about that, because I want to learn from you as well and kind of get your thoughts. So, man, every time I hear the word autophagy, fasting and upregulating genes, I'm like, okay, well, how are you measuring this? Is this an even measurable thing that we can actually, measure clinically, right? And then is it significant, right? And I don't want to say we need to be evidence limited, meaning that if we don't have this huge, clinical trial, then we shouldn't use it. Sometimes we need mechanistic data to make informed decisions. And that's kind of how I came to my conclusion about a ketogenic diet. But like, I just don't know. In the short term, I think fasting could be very beneficial, especially for its role in kind of clearing out some of this debris within the brain, kind of improving gut health as well, calm down any inflammation coming from that. But if you're doing fasting like long term just for the sake of autophagy, like because autophagy, like that's your response,
Yeah.
I think you may not, I think you're going to get diminishing returns. And I would say, like, I'm of the staunch belief that we want to, especially in this obesogenic environment, and something that I've learned from Ben House. He's a nutritionist from University of Texas. He's really great. But, something I've kind of taken away from him, like in this obesogenic environment, like you're not going to win by constantly restricting yourself. Most people's willpower does not allow them to fast all the time and constantly restrict. At some point, that's going to break. So how can we get them to be as resistant, or not resistant, but growth-minded as possible, right? And a lot of that is building lean body mass, and we know that is going to be beneficial for metabolic, mitochondrial health, whatnot, and all-cause mortality. So I just would question, like, okay, yes, maybe we could use fasting in the short term, maybe autophagy, we don't really know. But for like the long term, does that make a huge difference? And all of that effort you're putting into it, is that worthwhile? Like, I cringe every time I hear Peter Attia doing like a 7-day fast. I'm like, dude, that is crazy. I don't know.
Yeah, and a lot of it too, in our industry, we love to just spin down these rabbit holes and we get lost down them. And then we're, not we as in you and me, but just kind of our industry.
Yeah.
And then we're like preaching to the masses, all these, just, we make it so damn complicated, and it really doesn't need to be, like with fasting. And because keto and fasting, oh my gosh, like if you haven't ever tried keto or fasting, it's like, what's wrong with you? But I think it's all kind of silly, to be honest. I think it's really overcomplicated. So just like a week or two ago on social media, I wrote, like, have you heard of that new diet where you sometimes just don't eat, Because it's just like, yeah, I mean, it's normal to feast and fast. That you like 3 meals a day. That's a fallacious notion and idea that we made up, just like everything else that we talk about. But, so to your point, and especially when we're dealing with clients or patients, like we want to underwhelm, not overwhelm, of like, yeah, just starve yourself and it'll heal your brain. It's like, well, not really. But if we can, create the right environment, and the same thing, we could easily go down another rabbit hole of like BDNF and brain drive neurotrophic factor. And let's, be out in sunlight and lower cortisol and increase exercise because #BDNF. And that's cool, as we learn more about these mechanisms, and, oh, well, this upregulates autophagy and this activates BDNF. And that's all cool and everything. But the consensus, the punchline always brings us back to like nature and common sense, and ultimately more just like behavior modification of like, well, if you live a low stress, close to nature lifestyle, that's going to be primarily the most, anti-inflammatory or health promoting, so on and so forth. But, but again, though, there is something to be said for, understanding these mechanisms, and, how can we harness this for a short-term protocol and to move the needle? Because a lot of this stuff, to your point, like we can't measure, in like laboratory setting, yeah, but in a like clinical setting, no, you can't measure the autophagy related genes to see how well it's kicked on, so we don't know.
Yeah, exactly. And so, I mean, if you're starting to talk about like, so I guess I would preface this by saying like, I'm nutrition agnostic. I think that's like something John Berardi said of precision nutrition. Like, and I think that's the best stance to take. Like, you have all of these tools within your toolbox, and you know which one you can use for certain people, right? And as we were like talking before, if all you have is a hammer, everything looks like a nail, right? You start see a lot of these MDs who are just like, oh, they're, well, we only use low carb, but we only use keto. And I think you're doing a lot of people a disservice, because a lot of people may not be able to do that. It may not be the best thing for their certain circumstance. So I'm like I said, I'm nutrition agnostic. I just want to expand my toolbox and then just use it at the right time. And I'm still trying to figure that out. If you look at a ketogenic diet, I guess you first have to look at how do you look at like quality of evidence, right? Because I think so many times, especially in functional medicine, we look at mechanistic data. So things like cell cultures, oh, this gene was upregulated with, butyrate or glutathione or blah, 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 fill in the blank. And then we go straight to that. It's like, a $75 supplement. And maybe they've used that in clinical trials and have showed no benefit. I don't know. So what I'm saying is like, we have to look at the quality of evidence. And so specifically looking at ketogenic diet for traumatic brain injuries, the top of the tier in terms of the totem pole of evidence is going to be systematic reviews, meta-analyses, and randomized controlled trials. And there's some more hierarchy within that, but those are kind of the top tier evidence. And we only really have one good trial using ketogenic diets for those with traumatic brain injuries. It was done back in 1996. Paper authors was Ritter et al. 1996. It was kind of a two-part study. They first took a group of rats and they fed them various macronutrient ratios. And then they hit them in the head. It's awful. They hit them in the head. They took their brain slices and they saw which one had the worst outcomes in terms of contusion or bruising volume. And they saw that the diet of the lowest carbohydrates had the greatest clinical improvement. So like, okay, we're going to use a low carbohydrate, pretty much ketogenic diet in human trials, or in a human trial now. So they looked at.
Hey guys, I just wanted to take a moment to thank you all so much for listening to the Holistic Savage podcast. We on the Holistic Savage team all really appreciate you and want to stay connected with you. So please rate, review, and subscribe to help the podcast grow. And if you like the podcast, help get the word out. And now, back to the show.
I don't know how many people it was. It wasn't that much, but they had severe traumatic brain injury. So these are people, definitely in the hospital. A lot of them had a coma. A lot of them had brain bleeds. So these are not people like walking to my or your clinic, 5 years down the road with headaches or whatever type of secondary injury from a traumatic brain injury. They fed them a ketogenic diet. It was a liquid diet through a nasogastric tube. So not a regular ketogenic diet. And then they measured a bunch of markers, and I don't really remember what the markers were because there's more or less no difference, right? So we have one clinical trial showing no difference with a ketogenic diet for those with traumatic brain injury. Okay, so then you have to kind of go down another tier on the totem pole, and you start to look at animal research. There's an author, last name Prinz. He or she has done a lot of work in this area. If people want to look more into this, they can do some more research. They've looked at a lot of animal research and shows some possible improvements in the rats or mice fed a ketogenic chow. I don't know how this correlates to humans, but maybe a low carb diet may be beneficial. I think the most interesting thing that we have is looking at seizures as a model for traumatic brain injury. So ketogenic diets have been used since the 1920s for those with seizures and epilepsy, and it's been fairly promising for those with refractory or epilepsy or those that are not responding to medications. And then you start to look at a lot of the mechanisms that seizures and TBI share, and it's actually fairly similar. So we may be able to use seizures as a model to understand a ketogenic diet's beneficial effect for those with TBIs. And then you start to look at another step down the totem pole is mechanistic research. So looking at cell culture studies, looking at enzyme production and what happens with that. And there's some interesting things that occur when you feed these mice and these cell cultures ketone bodies and whatnot. It shows some promise in upregulating glutathione enzymes, and that's the way it shunts it into the pentose phosphate pathway. You're making a bunch of NADPH, and that's used for a reducing agent to make glutathione, and that kind of gets into the rabbit hole of biochemistry. It may be able to blunt some of the cytotoxic effects and increase BDNF. We were kind of laughing at that, but that's kind of like what we're left with when looking at this specific question is pretty low quality evidence. So for me, let's say Joe Schmo, he fought overseas. Now he's a veteran. He's came back, and 5 years after his tour, he's starting to develop maybe post-traumatic stress, some headaches, some gut imbalances. And we do evaluation with him, and the question is, do we use a ketogenic diet with him? This is 4 years down the road. Is we have to weigh that risk and reward ratio, and that's really everything that we do. But am I going to put him on a pretty restrictive diet if he's coming from a standard American diet? Maybe he's one of those people that does well with a lot of restrictions, right? There's some people that you give them, hey, black and white answers, and they're like, they love it. Other people want more nuance. So you just kind of, what kind of person are they? You have to assess that. If he's not willing to do a ketogenic diet, I'm okay with that. There's a lot of other things that we could work on. Again, Dr. Tommy Wood has done some interesting research. So he studies, I believe, neonatology, baby TBIs, more or less. And so he's done some interesting research and showing exogenous administration of ketone bodies, so through like ketone body salts and esters, may be beneficial. So maybe we could bypass a lot of those restrictions put on by that diet and just give them some ketone bodies. And I don't know, maybe that does the same thing. We don't know. And that's where the art of medicine comes into play. Like we're never going to have all the answers. And, you may have some people tell you, well, we don't have any clinical trials showing us this. And yeah, that's fine. That's when we have to become evidence informed and not evidence limited by the fact that we don't have super high quality evidence. So you just have to take it into context. It's promising. It's definitely not the end all be all. I would certainly use other interventions if someone was resistant or reluctant to try this out. But it's interesting nonetheless.
Oh, absolutely. And I love kind of I think this is a good, valuable, honest conversation as, we're just genuinely unpacking this stuff and showing how nuanced and imperfect it really is, because I don't think there's enough of that honesty in our industry. People just kind of make these claims, of like, this person's thing is that, and they just say it like it's law, it's truth, it works every time, the efficacy is on point, the data is on point. And in reality, it's just like, that's not true. There's so much about our theories and stuff that we just don't know. But, a lot of it though, as we're unpacking this, it's like, again, we draw it back and it comes back to that person saying, and, part of this, before I make that point, this is also where I don't know that health coaches always get like the credit they deserve. I don't know. It depends on the health coach, I guess. But a lot of it comes down to being a really good coach. Because like you said about, this rhetorical veteran patient or client, well, what resonates with them? What are they willing to do or not willing to do? Because client compliance and attention span is probably like the worst it's ever really been. The art of coaching in itself, I feel like, is more difficult than ever. And so that's where, all the mechanistic stuff is really cool. And I think there are some valuable takeaways. Like I absolutely know that there's going to be some major focal points of something I'd want to do with said individual. But at the end of the day, it's all about that client. So you mentioned John Berardi. And it's like Precision Nutrition was the first nutrition program I ever did.
Yeah, same.
And right on. I always kind of struggled and wrestled with the thing is, precision nutrition is all about, one habit at a time. Habit development leads to behavior modification. Modification leads to physiological change, so on and so forth. But then the hardest part is just trying to get that person to comply with that one habit at a time and actually making it into a habit. So, I mean, there is no perfect recipe for that. That's where communicating with the client or patient of, okay, so, we have all what we do know is, sunlight and exercise upregulate BDNF. That might help heal your brain. Like, let's get you out in nature. Let's get you out in sunlight. Let's get you moving. Let's get you eating whole foods and get off a highly inflammatory diet. But ultimately, yeah, it comes down to that person of what are they willing to, apply themselves to. Because unfortunately, I think a lot of functional medicine people are almost like so convinced of their own theory that, as we're elucidating, is kind of built on fragmented science at best. But that's their thing, that's their angle, and it's like, so
it's confirmation bias,
yeah.
You get into these camps like, oh, well, I'm paleo, or I'm, fill in the blank. And maybe that's like, I had a patient last week. She's like, well, do you believe in sugar? I was like, what do you mean, do I believe in sugar? I'm like, well, she's like, is it good or bad? I'm like, well, my question was like, it depends. Why do you ask? And so like not having this like staunch just entrenchment into all sugar is bad. Maybe let's say someone comes in with a traumatic brain injury. I'm like, yeah, your ability to metabolize sugar after a period of a week or two is diminished. Yeah, we should definitely, reduce that. But let's say someone who is like 200 pounds and they're a male athlete and they do CrossFit, 2 hours a day. They're going to have some sugar in their diet in order to meet their caloric demands. So I think we become so entrenched, and people are going to yell at me that I'm like pro sugar now. And that's not what I'm saying. As I'm saying is like, we have to be very contextual and nuanced in our beliefs. And we can't just have one protocol that everyone fits into. Right. And so like, I'll just tell you a story. So like last week, I was trying to like sift through like my practice management and like, how do I work patients from like where they are at, how they start, and then like where I want them and where they want to be. And I was like trying to think of like, okay, I'm going to make a nice little algorithm, and they first do this test, and this doesn't work, then we do this and that in stepwise fashion. And honestly, I spent like 2 hours doing that. I'm like, because I started doing this like mental game, like, okay, this patient I saw a few weeks ago, they would go down and to the left, and then, okay, then they would go right. And I was like putting them through my algorithm, like, well, that doesn't make sense. They can't do that. And so long story short is I wasted 2 hours trying to make a silly algorithm that no one's going to fit into. And if I want to be a good clinician, I'm going to try to take context into account. But yeah, we can't just be so protocol driven and so just entrenched into the simple stories that we believe, whether that's a nutrition protocol, whether that's a specific supplement, whether that's a test. And that's honestly, it's like, there's at times when in my short career, I'm like, oh my gosh, this is way too hard. You start to understand the complexity of everything. You're like, oh, I'm so stupid.
Mm-hmm.
And I think maybe that's a good sign. Maybe, I'm just trying to be humble and try to, figure it out myself. But yeah, our bodies we cannot deduce it into a simple algorithm, a simple protocol. We're way too complex for that. But I think the quest of trying to figure out is what makes, good clinicians great. And the people that I really respect are not like that. They're the people who understand and respect that complexity, and then try to do their best to take everything into consideration before giving someone a treatment plan.
Yeah. What's really funny about hearing you say that is I've been doing the exact same thing lately where, I'm looking at the client life cycle, from the inquiry to the finish line, and how do I, pave the perfect path that's cost effective and caters to, and you just can't do it. You just can't. Like I've been at the same place, and this is why, so many, there's another just random tangent, but there's so many freaking business coaches popping up all of a sudden. Like,
Yeah.
oh, you can't possibly be successful in business for yourself. Let me tell you how to run your business, even though I don't know anything about it. And it's like, that'll be $10,000. So there's all these business coaches popping up, and they all say, packages. And, so a package of lab tests. I'm like, that defeats the whole purpose of bio-individualized, but okay. So anyways, to your point though, I couldn't agree more. And that's where at the end of the day, there's so much to be said about just being, heartfelt, client, patient-centered coaching, how to be an effective coach. And I think that might be the biggest missing piece in our industry is how to be an effective coach. There's more coaching programs and certifications than ever before. And yet I feel like I see less effective coaching than ever before. But no, man, I mean, I love what you're saying. And it makes me think of that quote by, I think it was like Voltaire or something of, the art of medicine consists of amusing the patient while nature does the work or something like that.
Yeah, that's good. No, I know. So you work with a lot of health coaches, right?
Yeah.
Yeah. I think that's one of the most profound and impactful, first line people that we have in this dilemma of chronic illnesses and the astronomical financial implications it's causing, So I'll tell you a quick story. So like I learned the hard way with a lot of patients who I would just throw a lot at them. And when I throw a lot at them, it wasn't really that much. Maybe it was like a nutrition program and some supplements. It wasn't that much. They come back to me and they're like, I can't do all of this. Right. And then they're paying me, for an hourly rate, which is a lot more than, let's say, a health coach might be, to help work out these small little changes in kind of like a precision nutrition manner. I'm like, this is not cost effective. This isn't meeting my mission. So I've been asking patients, I'm like, okay, how do you want to be coached through this? Do you want to make small baby steps? Because we can totally do that. We can work slowly. Or do you just want me to throw some things at you and see what sticks, right? And to your point, like health coaching is I think is wonderful. And I think we can reverse so many of the awful chronic diseases, diabetes, I mean, just looking at diabetes alone, right? You spend $14,000 a year for a diabetic. I mean, the person's probably not going to be paying that out of pocket if they have insurance. But you look at a lot of these studies, just a 5 to 10% weight loss can mean metabolic benefits that, if they sustain that, can be lifelong. And that can mean being insulin dependent, being on an insulin pump for the rest of your life, into maybe just being on metformin, or maybe something, heck, maybe not even anything. And that could all be done with a nutrition coach. That's very cost effective. You're very effective with your time, money, and resources. So that's something that I would like to utilize in my own practice. And for those who are listening who are health coaches, I mean, your job is very impactful within this industry. And I would not say that just because you can't prescribe or whatever, that you're not making a difference. In fact, a lot of these things can be reversed with just simple nutrition habits. Because, you know, long-term in functional medicine, I don't want my patients to be on a bunch of supplements and medications. That's just a short-term intervention. But a lot of these things can be reversed with just some basic nutritional habits and lifestyle changes.
Yep, couldn't agree more. I always like to preach that, and that's why we all need to be working hand in hand, trying to narrow that gap a little bit, because it is 80 to 90% of the equation is just going to be the daily habits, the daily practices with the environment, lifestyle, psychology, and I'm with you. Like I like that 10-20%. I like to put together fancy protocols and look at the data. I don't really love health coaching anymore. But that's ultimately really what it is building those sustainable, you know, behaviors. So, man, this has been a really awesome conversation. Let's maybe summarize a little bit of with, like, what would you, or how would you summarize, maybe in a few steps, of if somebody has had a concussion or a TBI, you know, what would be some like bullet point recommendations or action steps as we wrap up?
Yeah. Well, it depends.
Yeah, right.
I love when you would ask your teacher, like professor, that in school, and they would come back with that answer. You're just like, oh, come on, man. Can you just give me an answer?
Yeah.
But I mean, in all honesty, it depends. So I guess some basic things that you kind of have to make sure you hit is you got to get a good assessment, right? Like, how many concussions is this? Is this number one? Is this number 2 or 3 within a year period? Like, you got to get the timing of everything. We talked about what's the state of their health or of their inflammation levels prior to that TBI or concussion. You may want to get some objective measurements. So concussion or CNS vital signs is a really good resource to get some objective data on processing speed, memory, both long-term and short-term, things of that nature. And when I talked to their representative, I think it was concussion vital signs. It was free. So if you're a parent, you can have your child in high school, or if you're a college athlete, you could do that prior to the beginning of your season if you're playing an impact sport. So soccer, football, anything like that. And then if you sustain a concussion, then you have a baseline measurement to be able to see your progress or regress, right? So that's a good tool. There's also some blood-brain barrier antibodies that you can get, like S100B and some of these other things that may be worthwhile, again, just to kind of get some objective measurements and, you know, measure again 6 months down the road, see if those were able to improve. You want to decrease inflammation, neuroinflammation. That's done through addressing microglial activation, and we could do that through specific supplements, medications if needed. I would prefer aspirin after a 4-week period for a few months over like NSAIDs and instead of like ibuprofen or Tylenol. Chris Masterjohn has done some work of using glycine and alkalizing your urine with the aspirin to make it function a little bit better. People could go check him out, and he describes that a lot better than what I would be able to do. You want to look at any GI imbalances. That's a huge one, because traumatic brain injury is going to predispose you to GI imbalances, and that's going to further increase inflammation within the brain. Other causes of inflammation, musculoskeletal health, you know, perspective and purpose. I know we did Brian Walsh's course, and he proposed some good information about just having purpose and community is associated with decreased levels of IL-6, CRP, lot of these inflammatory cytokines. And so, heck, just, finding community belonging and not being socially isolated is huge. And I know your big passion is mental health. I mean, you can make a huge difference just by whatever it is. Maybe it's finding Jesus or, being part of a community. I don't know what it's going to be like for you, but that's a huge thing that we kind of overlook because it's not fancy, right? You're going to have to ask a lot of hard questions. Kind of going down this line of some other things that you could look at. So you want to address excitotoxicity, magnesium threonate. You could do that with zinc, possibly. There's some medications like ketamine. I don't use that, and I'm not interested in using that. You want to maybe avoid some of these excitotoxic compounds found in the standard American diet. You want to exercise in a way that's not going to exacerbate your symptoms. So maybe take a week off from exercising at all. After a week or so, maybe start to slowly incorporate some exercise as your symptoms allow for. If you're playing contact sport, around the third week is when you could get into some non-contact play as symptoms allow for. And if you're doing everything right, maybe after 4 or 5 weeks, you could return to contact play without any downstream effects. What else? We talked about excitotoxicity, neuroinflammation. Another big thing is metabolic issues. And so real quick, and I know we're kind of ending here, but after a concussion, your rate of glycolysis or your utilization of sugar increases exponentially as concurrently your oxygen utilization decreases. However, after a period of time, we're not really sure how long, maybe a week or two, you have a hypometabolism of glycolysis. So you're not utilizing your blood sugar as you normally would. So that may be where a ketogenic diet may come into play, utilizing an alternative fuel source for your brain. Again, you got to weigh the reward risk benefit of a ketogenic diet maybe versus ketone bodies administered exogenously. And then other than that, I just got to think about this stuff and just kind of use it with the person in front of you. And I know there's protocols out there. A lot of the people I learned this information from have protocols. I guess I'm just hesitant to utilize those with every patient that walks through the door. So,
Sure.
But those are some key things to look at.
Absolutely. Good summary there. And, a lot of it, I think becoming that citizen scientist and taking ownership of your own health, we can't always be looking. I'm a big believer, healing comes from within, right? And we are our own greatest healers. And so, I think one of the best things we can do as health professionals is, educate, empower, and help cultivate that inner self-healer, if you will. Because too often clients, patients, they're looking externally, and there's so much innate wisdom to be harnessed there. And so I think using the roadmap that we've created throughout this conversation, while harnessing that innate wisdom and learning how to re-listen to your body that's trying so hard to communicate with you. There's no amount of biohacking gadgets that can replace that listening to your own biofeedback. So I think this was a super great conversation. I hope it helps people. And I mean, either way, I had a lot of fun just selfishly. So Gavin, thank you so much for joining me. I think it was great. You're a wealth of wisdom and really great soul stuff going on there. So thank you so much for joining me.
Yeah, thanks, brother, for having me. I really appreciate it. Hopefully some practitioners can utilize this, or maybe if you're, a self-healer, you can utilize this information. If anyone wants some of the information I present, I'd be more than happy to pass along the peer-reviewed research papers that I found to be useful in how I make decisions in my practice, because I just think we all got to help each other out and make this a little bit easier on each other. So yeah, thanks, Brendan.
That's what it's all about. So where can people find you if they want to learn more about you or get in contact?
Yeah, so unfortunately I have a Facebook.
Right.
I really wish I didn't, but I know it's like, you gotta stay connected to the people and just kind of figure out what everyone else is doing these days. So yeah, I mean, I have a Facebook. People connect with me there. And then I have a website, just first and last name.com. So gavingard.com. I put out some articles and just try to present this research in an easily digestible manner as much as possible. But yeah, those are two ways to connect with me. You go on my website, you can email me, call me, try to be as available as possible for people.
Perfect, man. Perfect.
Yeah.
Well, keep up the good work. Let's keep fighting the good fight together. And I look forward to the day that our paths cross in person so we can hang out, my friend.
Yeah, we'll have to do some deadlifts together.
Oh, absolutely, man. Bring it on. All right, man. Hope you have a great rest of your day. I'm sure we'll talk soon.
All right. Thank you.
All right. See ya.
Yeah.